the CH of GMKMC AMSA India. So today's webinar is SMILeye on the computer vision syndrome. Today's webinar is conducted under the Project Swasthya Jivika of Public Health Research and Development Department of AMSA India. And this project of AMSA India is under Swasthya Jivika, is a branch from the Public Health Stewardship Program aiming to increase awareness about and build occupational health in our country through the budding doctors. Now, AMSA India, that is Asian Medical Students Association India, is the Indian chapter of AMSA International. It is a non-profitable organization by the medical students and for the medical students to shape the future of global health. Now, as the college head of GMKMC AMSA India and being in the national working group of Swasthya Jivika, I'm going to be the coordinator and the host of the session today. So I once again welcome everyone to this session. Right. So technology has been a very big part in all our lives, and it has taken an irrevocable position in each one of our lives, both in personal and in the professional areas. Now, the impact that it has created is that it is an inevitable part of the life, and if we have been getting informed about all the updates and the trends in the technology and the gadgets, we should have also been getting the awareness of the do's and don'ts in the technological field. But however, unfortunately, we were not seriously taught anywhere about these things. So this webinar gains its importance because of this reason, that the pandemic has been creating a great impact in all our lives by increasing the online usage and the gadgets. So today, we have our wonderful eminent speakers with us to share the ideas and the different methods by which we can protect and prevent the different ailments to the body caused due to the computer vision syndrome. So before starting with the session, I would like to welcome all our speakers. So first, we have with us Dr. S. Sorama Devi ma'am, the professor and head of the Department of Ophthalmology from GMKMC Salem. Ma'am is a very supportive and ever enthusiastic person, and she is going to be the speaker of the first session, vision syndrome. Also have with us Dr. K. Nitya Manu, the associate professor from the Department of Physical Medicine and Rehabilitation, GMKMC Salem. She's a very dynamic and a diligent physician. Then we have with us our third, Dr. N. Shastika ma'am, medical graduate from Sri Lakshmi Narayana Institute of Medicine, Pondicherry, and she is with us to present the third session of the day. So without further ado, I would like to welcome our first speaker to the stage, present on the topic computer vision syndrome.
Where's the screen? Shall I start?
Ma'am, can you see the screen now, ma'am?
Yeah, I can see SMILeye. That is the PowerPoint.
Okay, one.
It's not coming on? Yeah. Shall I start?
Yes, ma'am.
It's not full, no? Can we make it full?
It is in the full screen, ma'am. It's actually in the full screen,
Okay,
ma'am.
okay then. Okay.
Yes, ma'am.
Okay. அனைவருக்கும் வணக்கம். Actually, we had decided to speak in Tamil earlier, and this afternoon we switched over to English. So let me talk. So I thought I'll say good evening in Tamil. இப்பொழுது நமக்கு விதவிதமான கேஜெட்ஸ், பல பல சோசியல் மீடியா, நான்-ஸ்டாப் டிவி ப்ரோக்ராம், எப்பொழுதும் நம் சந்தேகங்களுக்கு பதில் கூற தயாராக இருக்கும் கூகுள், வீடியோ கேம்ஸ், ஆன்லைன் கேம்ஸ், பிரைம் டிவி, நெட்ஃபிளிக்ஸ் என்ற எண்ணற்ற சாதனங்கள் நமது கண்களுக்கு விருந்து, மேலும் சவால்கள். இந்த விருந்து அதிகமா போனாலும் கஷ்டம்தான். There we land up in computer vision syndrome or the digital eye strain. Next slide. Next. Yeah, next, yeah. Who are the people who are affected by this computer vision syndrome or the digital eye strain? Otherwise, that's how it is called. You all know. Mridula, you have to change the slide. You all, these are the group of people, or everybody has got some gadget, even a housewife, even people who are working as laborers, they have a gadget. So everybody is looking into these gadgets, leave alone this high profile people. And in a recent study, it was found that was done among the next slide, among the pediatric age group, even children as young as 3 years were found to have symptoms of computer vision syndrome. Next slide. What is this computer vision syndrome? Next. This computer vision syndrome is the term that is being used for all the vision related and non-ocular symptoms that are caused due to usage of gadgets on a regular basis for 2 or more hours per day. Next slide. Why does this computer vision syndrome happen? Next slide. See, when we look at a distance, our eyes are normally relaxed. But when we have to look at the computer at a close range, we have to put in a lot of effort. And the computers are not, the letters or the characters on the computers are not as we see in a textbook or on a blackboard. Their edges are not well defined. This pixel, however high defined they are, their edges are not well defined. So on a bright background or a dull letter, there is a less contrast. We have to put in more of accommodative effect and keep staring at the letters without blinking to get hold of the substance or the matter in that page. Next slide. So this makes it very difficult for our eyes to keep maintain focus and cause a decrease in blink reflex. Next. This low blink rate is thought to be due to the high cognitive demand. That is, we need to understand what is written. So we tend to stare into the subject without blinking, that we don't want to leave any little thing that comes across. So high cognitive demand, low legibility conditions will lead to increased time to fix on that character or the subject for our brain to collect the matter and acquire the visual information. That will result in low blink rate. Normally we need to blink around 20 times, but here it comes down to 6 to 8 times. Both incomplete and decreased blink rate will result in evaporation of tear film and lead to dryness. And this will lead to the number of computer vision syndromes. Next. Then next, what happens is we want to focus. We want to focus on what is there on the computer. It is not that a number of times we just not look at the screen alone. We want to look at the keyboard. We want to look at the objects, and sometimes you have a computer where you look and you also work on your mobile. So there are a number of things at varying distances which you need to accommodate. So continuously putting your eye to strain and look at all these gadgets at a given point of time, the accommodation, after certain time, the muscles there get fatigued, and there results blurred vision, diplopia, myopia, transient myopia, etc. Next slide. And it has been found in computer users, there is over a period of time when they use this visual display terminals, there is a diminution in the power of accommodation, and also they have convergence insufficiency, so they are not able to fuse both their eyes and not able to read properly. So near vision becomes a problem when near vision has need to have convergence. So it becomes an eye strain and results in blurred vision. Next. So what happens when there is a failure of blinking and when there is a problem in keeping accommodation or due to accommodation fatigue? Next. So this is what happens. When there is decreased blink rate, you have ocular surface problems, that is dryness. And when there is an accommodation fatigue, you have asthenopic symptoms, tiredness, and vision-related problems. Next. What are those symptoms in the eye? Due to decrease in blink reflex, you have burning sensation, dryness, redness, and tearing. You might think, why dryness and why there is tearing? There is an abnormality in the tears that is secreted, so it does not stay coated on the ocular surface and it overflows. There is an epiphora because the constituents of the tear film are not appropriate, and due to evaporation a number of changes happen, and that results in tearing or watering. And this dryness also results in blurring of vision. And due to accommodative problem, also there is a blurred vision, diplopia, and this special condition of presbyopia, it needs much care as an ophthalmologist, as an optometrist, to give the appropriate type of spectacles to tackle this problem. And I told you there will be a transient myopia. When they continue to see at the computer for a long time, there is accommodative spasm and they go in for myopia. Myopia means short-sightedness, and there are complaints from the patients who say, after viewing my computer for a long time, I find I am not able to see distant objects clearly. And focusing from one object to another slows down the focus change. Next slide. So these are the different things that happen. Headache, eye pain, irritation, tiredness, watering, diplopia, redness. And these are the other non-ocular symptoms that results. Next. The same thing. This I have already explained. Next. And all this leads to frustration. You give up doing whatever job you are doing. Next slide. So what can be done to avoid all these things or overcome all these things? Next slide. Take care of your eyes. Next. Prevention is always better than going in for treatment. So if you have not prevented, then you have to go in for the eye examination. And this last thing is also very important. Okay, go to the next slide. Prevention. How do you avoid this eye strain? You have a regular eye checkup. If there is a convergence insufficiency, you do eye exercises. Proper lighting where you are working. You have to clean the monitor. We have glare, strain, blurred vision, all that can be due to dust particles accumulating on the screen or even over your spectacles that can cause a blurred vision. Adjust the distance between the computer and yourself. Avoid glare reducing. This I don't believe. And you can adjust the font size. If your vision has got a problem, then you increase the font size and make it a point to blink frequently, wear the appropriate glasses, and this 20-20-20 rule. Next slide. What is this 20-20 rule? Every 10 minutes of working on a computer, take a break for 20 seconds and look at an object 20 feet away. This is the 20-20 rule that helps in preventing dryness. Next slide. So the dryness is due to decrease in blink rate. To avoid this, they say we can set a reminder, but over a period of time, we will get used to it. We won't even know to blink. But what we want to look, we just keep on looking. But this 20-20 rule will be more appropriate. If the AC draft is going to hit on a face straight, then it will wash away the tears and it will result in dry eyes. So avoid this also. Next slide. Eye examination. You have to have refractive error corrected appropriately. Presbyopia, that is difficulty for reading near objects, but it differs from a book to a computer. For a computer, you need to have the intermediate distance corrected appropriately. Otherwise, you are going to have a problem. You're going to lift your specs or tilt your head and then look onto the screen. The next thing, if this is not helping, then of course lubricating eyes are a boon, and eye exercise for accommodation. Next. So use of glasses should be appropriate for the distance, especially in presbyopic. If you are going to correct for 33, for this is the reading distance which we normally correct, but this will not be enough in conditions of presbyopia. You need to correct for this distance. So you need to correct the intermediate. So the intermediate segment in the spectacles should be larger for us to view the computer. Those are called the computer glasses. And most of the time, minor defects like the astigmatism, which are very minimal, which are not of any problem on a routine life, gets exaggerated and causes symptoms when you tend to use the computer for long hours. Next slide. So this is the computer glass, especially in presbyopia. If this should not be the way it is corrected, it should be like this. The whole intermediate distance should be corrected appropriately. I am not sponsoring this lens. Next. If that does not work, lubricating eye drops. And now we have lubricating eye drops which are preservative free, and so they do not cause any problem. Before it was only with the preservatives, and the BAK that was added to that itself was a problem for the epithelial cells. But now we have preservative free lubricating eye drops that can be used any number of times for any number of days. And if that is well and good, if you are able to use that, it is really good. Next. Exercise for convergence. You have to look at the tip of the pencil and slowly move it close until very close to the face, and you should not see it double. If you're going to see it double, you stop there, relax, and then try to see again. So you will try to converge and see. So your convergence power increases, so you will not have blurred vision. Next. Food, water, and rest. Why have I added this? Most of the time we work for hours on the computer. For example, yesterday I was there on the computer, my last day to get this ready. 3 hours, I was fatigued. I didn't take food and water. And the next day I know I will have dryness and red eye. And my age also is a factor. Ladies are more prone at the age of menopause. They tend to have more of dryness. So women suffer due to their general physiology, and men suffer because of their work at their side. So food, you have to take nutritious food. Water, you have to drink adequate, otherwise your dryness will be more increased. Rest. You need to take rest in the night, and do not keep looking at the gadgets in dim light. This will be spoken by the technology speaker. Next. So on the Google, you can search for the self-examining questionnaire is there to assess if you have a computer vision syndrome or what. And you can know what you're suffering from. Next. So with all these things of headache, asynoptic syndromes, tiredness, eye pain, not seeing properly, diplopia, all this are symptoms that can mislead the diagnosis. It is just a simple computer vision syndrome, and a difference in the posture will make you all right. But having all this with the neck problem, you can even have amaurosis fugax, which will lead you to go to a specialist or a super specialist. Go to the next slide. The headache and the amaurosis fugax, which can result due to neck problem, and the eye pain. People are persistent to have their headache checked again because ophthalmologist will say you have no refractive error. It's very difficult for them to accept simple things. So they will go in for a neurologist opinion, MRI, come to an ophthalmologist with all the investigations done, and so we can happily treat them for the computer vision syndrome. Next. Radiation. This is the most talked about, but There is nothing like there are radiations from the screen that is harmful to you. No study has found it. Everything says that it is harmless to view the computer for any number of hours, except that you get eye problems. Next slide. So what can be the negative effects of the computer vision syndrome if it is not treated? Next slide. It can be personal. You will suffer from poor visual function, so you are going to get scared and stressed out, and it can be economical, and it can be social. You get less productive and less time available. Next. Thank you all. I care and stay safe. Thank you.
Thank you so much, ma'am. That was a really informative session. So, now I would like to add a few points on madam. Ma'am has been a very experienced faculty and practicing ophthalmologist for more than 25 years. And she has been trained in retinal lasers and indirect ophthalmoscopy, then phacoemulsification, and she is also a trainer of trainee ECC. And she also served as the district ophthalmic surgeon from the year 2007 to 2007. And I must mention, she has been awarded the maximum performer in cataract surgery in the year 2006 and also the best doctor award in the year 2016. So we had a great time with your session, ma'am. If the participants are having any doubts or any queries related to the topic, you can put it in the question box, and all the questions will be answered in the session 4 by the panelists. Right. So now that we have come to the end of first session, we'll be going to the backstage, and the second session will be started in few seconds. Thank you, everyone. She has also received awards like the Best Doctor Award in 2017, the Hanumant Rao Gold Medal in 2006, and to mention, she is also the co-author of the book, The Short Textbook of Prosthetics and Orthotics by JP Publications. And to add a feather to her cap, she has also launched the tele-rehabilitation for the first time in the country in Neuro Foundation this year, 2020. Now, I would like to request ma'am to kindly take over the stage to present the second session.
A very good evening to one and all. I'm a chronic pain physician. I treat patients with chronic pain. So over these years, this is my 18th year of practice, and over these years, what more evident is demographically, initially, patients coming with pain will be more manual laborers or blue collar jobs. Yeah? So patients who are involved in handling of heavy weights or a job that demands a lot of physical activity. And that was the picture of a person coming in with a chronic pain. But over these past decades, with the increase in use of computers, both by the professionals and the students, the picture of chronic patient has changed from a middle-aged manual laborer to a young adult or a school-going child who sits in front of the computer. Next slide, please. Next slide. So this was the ideal job. 90s kids, 2K kids, until recently or even today, sitting in front of a PC in an AC room is considered a dream by many people. If you job when you are there, what else do you get? Next. Next slide. So this dream job not only pays you or gives you your satisfaction, it also gives you a lot of other things. Ma'am has already told about the eye complications. Along with it, you have headache, the patients get a lot of neck pain, back pain, shoulder pain, elbow pain, and a lot more. So, is this job so demanding? Is this work so complicated? Not really. Actually, there is a Tamil saying by ஒரு அழகான திருக்குறள் இருக்கு. பீலி சாலம் சாலம் விட்டு பெய்யும். What this திருக்குறள் means is even a feather, peacock feather, when loaded more and more in a vehicle, it will break the vehicle. So this computer job considered to be a delicate and a very comfortable job also can break you back if we don't take care of small discomforts or small details.
Excuse me, ma'am.
In the computer. Yeah.
Ma'am, there is a little bit of internet disruption there, ma'am. Can you please look into it, ma'am?
Yeah.
Your voice is breaking in between, ma'am.
Okay. Can I switch off my video so my audio might be clear? Mridula?
Yes, ma'am. Can you please
video?
speak, ma'am?
Yeah? Am I audible now?
Yes, ma'am. It's audible now. Yes, ma'am. You
Mridula?
can proceed, ma'am.
Okay. So, these injuries which happen in people who are computer bound or white collar job, we call it as repetitive strain injuries. So this is not a single strain which has caused the problem, but the repetition is also called as cumulative trauma disorder. Cumulative is addition. So simple injury, when it is added upon day by day or on a daily basis, it results in a permanent damage. It is also called as overuse disorder. It's like this. So, how big is the burden? Globally, there are days which we celebrate. So, the last month was that is a breast cancer awareness month because the load of breast cancer and its impact is more. Similarly, we celebrate a day called Repetitive Strain Injury Awareness Day on February 29th, the day which does not repeat itself every year. So, we have to avoid repetitive injury. That's what is meant. This selection of the day was made for stressing on the importance to avoid repetitive strain injury. And this has got an impact not only financially, also on the health sector. It has got a very big impact due to sickness, absenteeism, and all. Next slide. Next, please. Okay. So this is how we define a repetitive strain injury as any injury to the musculoskeletal or nervous system which is caused by repetitive use, vibration, compression, or long periods in a fixed position. So it is wrong to sit in a similar position also. It's wrong to same posture on the nerves or muscles. Next. Okay. So this picture shows what the ideal posture is. We all have come across this. Easily accessible. You can Google it and see. And everybody says you have to sit straight. Your neck should be supported. Your neck should be aligned. Your neck should be straight. Teaching how to do is simple, but teaching why to do that is more important. Unless we understand why sitting like this or using our hands like this is important, we tend to forget it. And especially, next slide, especially today, now the kids are in the zone. There are increased incidents of repetitive strain injury in kids. and kids do things only when we explain them right. Gone are the era where we always obey. Parents say, teachers say, we say yes and we do. Not like that anymore. Nowadays, we need to explain to the kids and everybody why we are asking them to do a certain thing. Next. So, I showed you the ideal posture for computing. But this is the common posture of computing. Around, or your spouse, or your friend, everybody on PC and working. This will be the commonest posture where they will strain not only their eyes, they are straining their back, neck, shoulder, and the arms. Right? So, what kind of damage is it causing? It is simply sitting, right? And it damage your body. Next. Next. The so-called simple sitting, that's sitting in a chair. This has a very big demand on our body. To defy gravity and sit on an erect posture, we need to use 48 sets of muscles, or 96 muscles in your back, which are arranged in 4 layers. And it is almost like it's like that. The spine will be in between, and the abdominal muscles and the back muscles are contracting alternately the spine in the central position. And here, when you talk about spine, there are two things. When you look at your body, the upper half of the body, the upper limbs, they are more mobile. You can move your fingers and shoulders to a wider range of movement. There, the precision needs to be, or the importance needs to be on the mobility and precision of movement. In the lower limb, it is going to be in the hip and knee, it is more of stability component. The muscles are bulkier, the little bone joints have little range of movement. Whereas when it comes to spine, you need both mobility and stability, right? So the spine is like a bead, is a string of beads. You have 33 vertebrae which are held together by these 96 muscles. So what happens? There should be a balance between the mobility and the stability component. And that is where we end up misusing or overusing the spine. Next. Let me show
Excuse
you
me,
an
ma'am.
example.
Ma'am, sorry to interrupt you in the middle, ma'am. Actually, your voice is buffering very frequently, ma'am. Can you please check the connectivity again, ma'am?
Okay.
Can you speak now, ma'am? Let us just check it, ma'am.
Hello. Hello. Am I audible?
Yes, ma'am. Yes, ma'am. I think it's better now.
I see that it
Yes,
is
ma'am.
good. Yeah, it's better. I see full connectivity here. Okay. So what I was trying to tell
Yes, ma'am.
is, the spine is acts like a string of beads, where each bead needs to be stable enough, and the string has to be flexible enough to allow all movement. Just think of a day at an office. You sit in a chair, reach out for the water bottle, reach out for your pen, book, and use the keyboard as well. So all these things will involve complicated spinal movements and upper limb movements also. So that is where we end up misusing or overusing the spine. Next slide, please. Next slide. So this is an example to show why maintaining a proper posture is important. So the left side shows the normal ideal position, that is holding in your neck. What happens here is, in the picture A, there are muscles working, two in the front and two behind. So these flexors and extensors will work together to maintain the spine, and the load is taken up equally. Look at the other picture, picture B. This is the commonest posture we use and end up having shoulder pain. Exactly in the red strip. That is the muscle which takes up the brunt of that when you keep your neck protruded. Okay, so here the muscles in the front, they don't get to work. Whereas the muscles in the back, they take the load fully and they are stretched also. It is like pulling an elastic band and then keeping a stress on it. So a stretched out elastic band cannot take adequate strain on it and end up with. Next slide, please. So this slide shows the normal degenerative changes over time with different ages. So the first one is 20 years, 40 years, 60 and 80 years. But mostly because of this posture, what happens is patients end up in this posture of 60 years very early due to the occupational injury. Next slide. So what is wrong for more than the muscle strain? So why did I say that we are placing a weight on a stretched elastic band? So the first picture from the left shows the normal position. The weight of our head is normally around 6 to 10 kgs. So everybody has a weight of skull and brain, which needs to be balanced with the neck muscles. Our neck muscles are designed to hold only this amount of weight, that too in specific posture at 0 degrees. But what happens?
We are extremely sorry for the participants. There is quite a little bit of internet connectivity problem with the speaker. We'll just resolve that in a minute, and we'll get back to the session. Very interesting session, actually. Okay. So now that the third session has come to an end, we'll move on to the fourth session, where all the doubts and queries of the participants can be discussed. So if anybody is having any questions on the content, you can kindly ask in the questions box or even in the chat box. And we'll also be discussing the questions which have been previously asked through the Google Forms by various participants in the fourth session. So thank you, everyone. We'll join back. Welcome back to all the participants. I welcome you all to the fourth session, where we'll be discussing all the questions which were previously asked through the Google Forms. And if anybody has any doubts, you can kindly post in the chat box. So we can start with the session, and here we have our speakers, Dr. S. Sorama Devi ma'am and Dr. N. Sashtika ma'am with us. So ma'am, the first question is, I'm wearing spectacles due to eye power increase, but nowadays I can manage without spectacles. So does my power get fixed naturally? And being a myopic, will my power get affected in a much difficult way than the normal people, ma'am? So this was a question asked by Priya.
The question is, she had spectacles and now she doesn't need to wear spectacles. two things can happen. Either when she got the spectacles and she said she's a myope. When she was checked for spectacles, she must have been having accommodating, so there should have been spasm and she would have exhibited myopia, and it would have been corrected just like that. Or the myopia should have been 0.5 or 0.25, which is very subjective. So that's the reason that refractive error would have gone up. Normally, if properly checked and you are prescribed spectacles, it does not. Whatever refractive error you have, it stays there. Unless there is some other change in your cornea or in your lens. Otherwise, the refractive error does not go away. So she said she's a myope. So I think there must have been a problem while the examination was done to give us spectacles.
Okay, ma'am. Thank you.
Is that okay?
Yes, ma'am. So the next question is by Avian Anurag. He has asked that is there any special advice for astigmatic people with regard to computer vision syndrome?
Yeah, that's what it was there in the session also. Astigmatism, it can be very low or it can be high. If it is going to be very low, normally when you're not using these gadgets, you might be able to see properly in a normal day-to-day work by little bit of squeezing or squinting, squeezing your eyes, making your palpebral fissure narrow. But if you want to do continuous work, your muscles cannot adjust for that continuous work, and even little amount of astigmatism will produce asthenopic symptoms, that is tiredness, eye pain, headache, etc. So you need to wear appropriate astigmatism correcting spectacles when you have to work in the computer for a long time.
Okay, ma'am. Thank you, ma'am. And the next question is a person from Calicut has asked, I read somewhere that looking on screen for a long time is not the actual problem, but the eye becoming dry is the issue. So is it sufficient to wash our eyes and stay hydrated to avoid the strain? Your answer, please.
Looking on the screen, that is the problem. No? You continue to look without blinking. Looking on the screen is not the problem, as is been mentioned, but it is the reduction in the blink rate. You fail to blink, and that is the reason for your eye to become dry. And my advice would be, don't wash your eyes with water. We do not know what the water has got. Anything can happen on your cornea, you can get infected. Washing the eye with water is not advisable. You can use lubricating drops.
Okay, ma'am. Thank you, ma'am. And the next question is by a part-time teacher, Sujitra. So she has asked that she's having a power of 5.5 and 6 cylindrical in both the eyes. She says she still feels that her eye got a lot worse, but she could not get out of the mobile addiction. So actually, this was a very frequent question asked by many people, ma'am. Even if they know that it's injurious, it's not good for them, they have this mobile addiction. So is there any way that they could motivate themselves?
So you want a solution for the mobile addiction or to see better? If it is for mobile addiction, I think you should go for a psychological, a motivation program. But I think one of the things that can be tried is you don't have the net connection. You ask someone to switch off your net connection for a few hours, or you leave your mobile phone in some other place and work in some other place. You have to try what suits you. You have to find out what suits you. So addiction is an individual's problem. No? They have to find various ways. The net connection can be switched off. That would be the best thing. Give the charge to somebody.
Okay, ma'am. So they should try ways of staying away from the.
Yeah, get help from their friends, their near ones, no?
Yes, ma'am. That's true. Okay, ma'am. And the next question is a question from a parent. The question is, can a child on treatment for lazy eye watch digital entertainment with the other normal eye?
So the treatment for lazy eye is to make the lazy eye work better. So asking the patient to see with a normal eye for more hours is going to make the lazy eye more lazy. It's not going. It will not serve the purpose. But they can have times off, no, 1 or 2 hours off where they'll get free time to see with a normal eye. But using the normal eye always is not the best thing to do when you are getting treatment for amblyopia.
The next question is, the person says there's a doubt on whether when we see computer or mobile phones for a very long time, after that for some days the vision is blurred. Does it indicate a change in the power, or is it not?
Yeah, it is. How long does the defective vision stay? One is immediately they can have defective vision that is due to dryness. Your vision is not going
able to hear us, ma'am?
Can you hear? You can. Yeah.
Yes,
you will not be able to hear.
Now, ma'am.
Sorry. If it is going to be a short period of time, it may be due to the dryness. Or as you continue to look into the computer screen and try to see small letters, fuzzy letters, which are not clear under high contrast, then your eye is straining too much to see those letters. Then it goes in for spasm. That results in myopia. So myopia is you cannot see what is at the distance. So that might be the problem, and you need to relax your muscles. It might take a few hours. Next. Yeah. Virthala, hear you?
Okay, ma'am. So, yes, thank you, ma'am. And the last question is asked by a student from Shivagangai. The question is, does our eye strain a lot when we use phone while lying down instead of sitting position, or is it just a myth?
Oh, I didn't listen. What was that?
Okay, ma'am, I'll repeat the question. Our eyes strain a lot when we use phone while lying down instead of sitting position, or is it just a myth?
No. It is definitely, there is a lot of stress because you're not in the normal position. Your head is going to be tilted, your hands has to support, and there is a lot of strain on the neck muscles. It's definitely harmful. When you sit and see, you can look down, so your eyes will be half open. But when you lie down and see with a gadget you hold above you, you're going to have your eyes more open. So it is a stress on the muscles, on the neck muscles, as well as on your eyes. Your blink rate is going to become low, your eyes are going to be more open, and it is going to dry.
Okay, ma'am. So now we have a question in the chat box, and yeah, I'll read out the question, ma'am. How to correct if a person has both myopia and presbyopia and using computers for a long period? So the person is finding difficulty to use computers using bifocal spectacles. What's your view on
So
it?
myopes will be, if myopes will be able to see clearly on the computer, so at the presbyopic age, say for example, it varies from up to the age of 40 or 40. Okay, if the myopia varies from up to 1 diopter to 3 diopters, you can go without the presbyopic correction. You can use the gadgets without wearing spectacles for near. But if it is going to be more than 3, then definitely you will not be able to see near vision also clearly. Then definitely you have to use a presbyopic glasses with the intermediate distance. So this progressive glasses are better. So the intermediate distance should have the correction appropriate for the distance between the eyes and the computer screen. How far away you sit normally. It has to be done personalized. So you have to tell the ophthalmologist or the optician who makes the spectacles for you, tell the distance you want and get it corrected, adjusted appropriately. Okay. If you can see the screen without spectacles, without any problem, you can see the screen without correction for presbyopia.
Okay, ma'am. Hope that answer was helpful for them. And there's another question. Kindly explain about the blue blocking glasses, ma'am. I would like to take this question to Dr. N. Sachtika, ma'am. Can you just elaborate once, ma'am?
The blue light glasses, as we saw already, it has a special coating in the glass. So it will block the blue light from entering into our eyes. So this blue light, if it is blocked, the melatonin production will be the same. But as such, when we see the minimum amount of this blue light will not have any, does not cause any retinal damage as such. So we use only for the blue light filter glasses only for to restore the melatonin production.
Okay. Okay, ma'am.
Have correlation with retinal damage.
Okay, ma'am. So I think those are the questions which are here, and most of the questions which was yeah, there's another question, ma'am. The question is high definition quality videos on digital platform. Does it really ease the eye, or does it all depend on the filter?
Even high definition quality videos, they don't, they are not helpful anyway. Still the edges are blunted, only the central part of any character or any material you want to read is fully visible. Even in high definition quality, it does have harmful effect on it. Maybe it is a little better, but not like the previous computers we had where the pixels were very low. These high definition pixels are better, but still it has got its own effect. You don't blink, that is the problem.
Okay, ma'am. Thank you, ma'am. Those were the questions. Yes, and actually a lot of questions which were asked through the Google Forms were answered through the sessions. So we hope that the participants were benefited through the session, and I thank all the speakers for taking their time despite their hectic schedule, especially during this pandemic. And thank you so much, speakers. So I hope the participants would have got benefited through the information gained through the sessions. And I should also regret all the participants for the connectivity issue which happened in the middle. We'll be posting a recorded video of the sessions also, so you can get benefited through that. And the session actually doesn't end up here. All that you have learned, only if you share it with the people you know, the people you care for, that will only make everybody. So I request all of you to proliferate the knowledge that you have gained here and everywhere to all the people you care for. So now that we have come to the end of the session, I extend my gratitude to the AMSA in India for providing this platform to conduct an important webinar on the need of the hour, the computer vision syndrome. So thank you, everyone. Now we've come to the end of the session, and if anybody have queries or any doubts with regard to computer vision syndrome or any other ocular symptoms or symptoms in the with regard to the rehabilitation, you can anytime contact the speakers, and we'll be providing the contact numbers through the WhatsApp group, so you can get benefited through that. Once again, thank you one and all.
Mithila,
yes, ma'am.
Mithila, I have a word to add.
Yes, ma'am. Sure, ma'am.
I appreciate you for the effort you have done, the persistence you had. Hats off to you. Good. I'm proud as a teacher.
Thank you, ma'am. Okay, so we'll come to the end of the session. Thank you, everyone.